Direct Care LLC runs Ketamine Colorado Springs, and we want to find out what makes them so different than other ketamine clinics here in Colorado Springs. So today we're talking to Dr. Chuck Weber and Dr. Jeff Gainok, and we're talking about, what makes you guys so unique and a little bit about your clinic. So can you tell us about that?
Sure. Appreciate you coming by, and
Well,
thank you for taking the time. So Direct Care LLC, we've been around since 2014. All four of us were doctoral levels, and we're all veterans. Right? 3 of us are combat deployed veterans as well, and I think that we bring a unique experience not only to medicine and to establish treatment of major depressive disorder and PTSD, but also because we know this community. So we know this community, we know our veterans, and we want to take it actually to the rest of the community. So although we specialize with veterans, we're here to help everyone.
Okay, you're here to help everyone. And one way that you can do that is with a ketamine infusion therapy treatment. So, kind of tell us a little bit about what that is and what it does.
Sure. So ketamine infusions allow patients in the depressive state to kind of remodel their own brain per se. So imagine that a depressed patient has a city block in their mind, and half the lights are off. With just one infusion of ketamine, we can turn all those lights up and make it significantly brighter. Patients report results within 1 hour versus conventional treatment can take 1 to 3 weeks.
Oh, wow. Okay, so what is an infusion like? Because, I've heard ketamine infusions before. I don't know what it means. What does a therapy look like?
Sure. So our patients come in after doing a consult with myself or my wife, Dr. Janet Gainok, making sure ketamine's the right fit for them. We bring them into the clinic. We check their vital signs, talk to them again, start an IV, and we give them an infusion over 40 minutes. During that infusion, they get into a mild dissociative state, very transient. The real hero of ketamine, though, is what happens with those 6 infusions. Over the course of 6 infusions over 2 weeks, the brain actually remodels and changes the way that patients think about things and increase synapses in the brain, making things more clear.
Okay, so you're saying it takes about 6 treatments over 2 weeks. That seems like a pretty fast result. How do you need to keep doing treatments to make it last?
So unfortunately, ketamine is not a cure. It is a treatment. Most patients report significant changes within 1 to 2 infusions. By the 6 infusions, they have significant results. Up to 70 to 80% of my patients report that they have significant better outcomes. And how often you return is completely dependent on the patient. I've got patients that come in every 3 months. I've got patients that come in every 2 weeks. It just depends on the patient's needs. That's one of the things about our infusions that are really pride ourselves on, is we will get the exact dose and the exact interval that custom tailor the best infusion process for you.
Okay, and what probably makes them feel more comfortable is that they have a doctor here
Correct.
watching them while they're doing the infusion.
Correct. I've been doing anesthesia since 2009. I've served in combat zones as well as in America, taking care of soldiers and active duty as well as their families. I've given more ketamine than I can account for, just tons and tons of ketamine. And I have over 100 infusions here with patients as well as my wife, Dr. Janet Gainok.
Okay, and it's nice. It's a family operation, so you guys
Correct.
are, working very closely together.
Correct.
You have,
Yes.
Yes.
That's absolutely wonderful. So who would benefit from a ketamine treatment? You guys were both combat veterans, so we know, people who go overseas often come back with PTSD. It would work for them, but is this for the everyday person as well?
So patients who have major depressive disorder or treatment-resistant depression, patients who've tried conventional therapy and things aren't working for them, this is an option. We tell our associates that if you have patients that you're trying to move in the right direction and you can't seem to get there, ketamine would be a viable option for them.
Okay, so they would come in and talk to you, and
Correct.
you decide if this is right for them.
Correct. And ketamine's safety profile is very, very, very good.
Okay.
To say I trusted it when my son had to have an anesthetic, that was the medication that they gave him. So I believe in this medication wholeheartedly in both the anesthetic purpose as well as the treatment of depression.
Okay. All right, gentlemen, if someone is interested and they're in regular conventional, medication along with therapy isn't working and they'd like to get in contact with you, how can they do so?
So Ketamine Colorado Springs is our website.com. That would be the best way to do it. From there, they can schedule a free consult with one of our administrative assistants, and they will schedule a consult with me or my wife, and we will talk to them and start the process.
Wonderful. And you guys are located, Direct Care LLC is located where?
Off of Circle Drive. So we're here at 2860 Circle Drive up on the 4th floor.
Wonderful. You can always follow them on Facebook and Instagram, directcarellc.com, or call 719-464-6752 for more information.